Welcome back, everybody. We live in a beautiful coastal town with miles and miles of pristine beaches and tons of things to do outdoor, but that also means a lot of sun exposure, putting it at higher risk for dangerous skin cancers. Coastal Dermatology, located right here in Charleston and Mount Pleasant, specializes in preventing and treating melanoma, a deadly form of skin cancer. And Dr. Michelle Middlebrun from Coastal Dermatology joins me right now with much more. So, Dr. Middlebrun, tell me about this Skin Cancer Foundation saying 1 out of every 5 Americans will develop skin cancer at some time in their lifetime.
Yes, thank you, John. 1 out of every 5 Americans will develop skin cancer. So if you're standing in a room full of 6 people, you can look around and just pick that one who's going to get it. It's usually going to be a person with fair skin, light eyes, blue or green eyes, someone who has excessive moles, more than 50 are going to be at higher risk, and also a history of sunburns or just excessive sun exposure in your lifetime puts you at a higher risk for skin cancer. Of the types of skin cancer, there are the more common types, the basal and squamous cell carcinomas. That's 90% of what people will get, and those are largely treatable with surgical and non-surgical modalities. The more serious types of skin cancer would be melanoma. Right. And every hour, 1 person in the United States will die of melanoma.
Now, we've got some pictures that you provided. Tell us what we're looking at right there.
That is a picture of a melanoma, actually, John. That's an irregular lesion. It's got dark colors, light colors. We talk about the red, white, and blue effect of typical lesions like this. This probably was a mole that started to change and evolve. That's another melanoma. You see the irregular shape, the very dark color, the light color in there. So those are all things to look for when we're suspicious of moles. We're looking for irregular shape, size, color variations. Anything that changes in a mole really should be evaluated.
I remember there was an issue of raising a mole as well last time I dealt with skin cancer. Does that still hold true?
Well, you know, that's a little bit tricky because raising could be a normal phenomenon, but if it's a change in an existing mole that was flat, raising could be significant. So you always should check with a board-certified dermatologist, have your skin evaluated. If there's any question, don't hesitate, call your dermatologist.
So when in doubt, definitely check it out. Now, tell us a little bit about preventing. How can we prevent those moles, those melanomas, skin cancer from coming?
Well, great. Best defense is a good offense. Yeah. So what we talk about in dermatology is safe sun. So you want to avoid the sun during the mid part of the day. So early in the morning is fine to be out, late in the afternoon is fine to be out, but during midday, we talk about between 11 and 3 is the most dangerous time. So seek shade, seek shelter. Also, sunscreen is extremely important. We want to use a high SPF sunscreen, apply it 30 minutes before going outdoors, reapply frequently during the day. The lower the SPF, the more often you need to reapply the sunscreen, and that's something a lot of people don't realize. You
know, whenever I go out to the beach, I apply and I do it ahead of time and get out there, but then when you go in the water, you expect these things to be waterproof, but they really never are waterproof, correct?
That's correct. There's nothing truly waterproof, nothing truly sweatproof. You're going to have to realize that it's going to come off, and it actually breaks down in sunlight. Strong sunlight without even sweating or toweling it off is going to break it down. Reapply every hour, every 2 hours, whatever you need in strong sunlight to keep yourself protected.
If you're getting those sunburns every time you go to the beach, what are some of the steps that you can take to mitigate the damaging effects of the sun?
If you're getting the sunburns every time you're going down to the beach, you need to be more careful because that's it. Sun protective clothing, they make protective clothing with long sleeves that's comfortable. You can find those now. Fishermen wear them quite frequently. I see mothers putting them on their children. Hats with brims are important. That'll give you some extra protection. But there should not be a sunburn on anybody.
Now, you guys just opened up a location right near Brickyard in Mount Pleasant on Highway 17, and you've got all the state-of-the-art equipment to try and prevent skin cancer, and then if you do get it, to battle it. So tell us how you do that.
Okay, well, one of the things we do is we do surgery. We perform Mohs micrographic surgery where we do controlled borders, making sure the skin cancer is clear before a patient leaves our office. We also have modalities of treatment that include light therapies for people with sun-damaged skin and pre-skin cancer changes called photodynamic therapy. We provide laser treatments for patients, and we also do a lot of photorejuvenation for patients who are sun-damaged and just want to appear better.
Yeah, so this can be treated if you catch it early enough. It can be treated. You'll have a great chance of survival.
Skin cancer is treatable, definitely. Early detection, aggressive treatment sometimes is needed for some of them, but definitely treatable.
All right, all the information right there on your website right now. Call 881-22 888-848-6565 or hit that website on your screen. Dr. Michelle, thank you so much for spending some time with us and great tips.
Appreciate it. Thank you,
Great
John.
to meet you. All right, stay with us. We'll be right back with much more.